Every 10th of May is World Lupus Day, a global campaign aimed at raising awareness for millions of people affected by the autoimmune disease. It's a day to shine a light on their daily battles, correct the myths, and fight the stigma often associated with the illness. Zainab Akonde has details in this report.
Lupus is a chronic autoimmune disease that happens when the body immune system turns against its own tissues and organs. Despite the global impact of lupus, awareness about this disease remains alarmingly low, and according to the World Lupus Federation, over 5 million people worldwide live with some form of lupus, and about 90% of them are women. This awareness event serves as more than just a gathering. It is a platform where individuals living with lupus share their personal stories and inspire others with their strength and resilience.
Is that there is no center to screen for lupus in Nigeria. You have to take our samples out of the country, and this is quite expensive, very expensive. So we are calling on the government, we're calling on everyone to please put an eye on lupus, make lupus visible. I've been sick from childhood, but nobody knew it was lupus.
Beyond the fatigue and joint pain commonly associated with lupus, many patients also live with a signature butterfly-shaped rash across the cheeks and nose, skin irritations, and in some cases, organ inflammation. Sadly, children are not exempt from this complex disease. Oyedamola Unifade is the mother of a 6-year-old girl battling lupus. She shares how painful it is to watch her daughter go through constant discomfort and hospital visits.
When it started more like just a joint pain. Then later she started having cough and the rest. Then we were in and out of hospital. Even we went to a general hospital before the last general hospital that she was diagnosed of lupus. So it has been they even think it's tuberculosis because she will start coughing and she will not breathe well.
To be honest, those children, they even need therapy than the adults. Some of them will come, they will tell you, do not take blood samples from me today. I am tired. I'm actually tired of blood samples being taken from me. I'm tired of taking these medications.
I'm not giving up. Because
for Olorutosin Shomide, a mother of 2, lupus has not only taken a toll on her health, it cost a marriage. Her husband left, unable to cope with the realities of her illness.
He didn't want such a burden on himself. So he felt the statement was, go to your, I'm done with the whole thing. I thought it was a joke. I was still feeling it's normal for someone to get to a point where maybe he's tired. And I felt like my health issue, it could be a burden on him and it's weighing him down. So I was trying to understand the situation, but it got worse and it got to the point that it doesn't even if it comes around me, I became detestable, let me use that word, even to be seen. At some point it got physical on me. Abusive statements, depression. I don't need those stress, emotional torture with what I'm going through.
Though lupus is unpredictable, medical experts say it can be managed with early diagnosis, medication, and ongoing care.
They have to take their drugs in addition to the lifestyle changes. Eating healthy, avoiding fatty food, for instance, exercising, learning to manage both physical and emotional stress. All these are very important because these are things that can flare up the lupus. And of course, for lupus specifically, avoiding sunlight is very important.
Through shared stories and support networks, those affected by lupus are building hope, not just for survival, but for a future where they can live with dignity, free from discrimination. Zainab Akonde, TVC News, Lagos.